Kerala Health Minister Veena George said on Thursday that the latest statistics show that the COVID-19 disease transmission within homes is increasing in the state. According to the press release, a study conducted by the Department of Health showed that 35% of cases were transmitted within homes. When a person in the house gets infected, it is transmitted to everyone in the house. This is because the home quarantine guidelines are not strictly followed. Only those who have required facilities at home can prefer home quarantine. Others should shift to DCC centers, said Veena George in a press release. The health minister asked people to strictly follow the instructions of the health department. Those who are in the home quarantine should not step out of the room. Everyone in the house should wear a mask. No one else should use the utensils or articles used by the patient. Everyone in the house should wash their hands frequently with soap to avoid transmission of virus. The minister also released a set of directions that should be followed by the people to avoid the spread of the virus. The minister added that there are no ICU or ventilator crises in the hospitals. There is no ICU or ventilator crisis in hospitals in the state. Intensive care is not a problem in any district at present. There are a lot of worrying campaigns going on. In addition to government hospitals, COVID treatment is also available in 281 empaneled private hospitals providing free of cost for APL and BPL categories. If ICUs in government hospitals are not available, there is a facility to shift patients to private hospitals with ventilator facilities for treatment. Therefore, there is no need to worry, the health minister said in a press release. Out of 3,048 ICU beds in the government hospitals, COVID patients have been admitted to 1,020 beds and non-COVID patients in 740 beds. 1,288 ICU beds are vacant. Of the 2,293 ventilators, COVID patients were admitted in 444 beds and non-COVID patients in 148 beds. 1,701 ventilators are vacant, she added. According to the statement, there are 20,724 beds in 281 empaneled private hospitals equipped for COVID treatment alone. These hospitals have 2,082 ICU beds and 1,081 ventilators. In private hospitals, 798 people are in the ICU and 313 on the ventilator for COVID treatment. If the number of COVID patients increases, the number of beds and ICUs can be increased in private hospitals. Therefore, there is no need to worry, said the health minister. Meanwhile, according to the health bulletin issued by the State Department, Kerala reported 30,007 new COVID-19 cases in the last 24 hours, accounting for 58% of the total cases reported in India. As many as 18,997 people recovered from the disease, while 162 deaths in the last 24 hours. The active cases have climbed to 181,209, while the death toll has mounted 20,134. The test positivity rate in the state stands at 18.083%, as 166,397 samples were tested in the last 24 hours. News Desk Kaumudy, English.